So, with the coronavirus and everything going on, at least for one individual, his healthcare is kind of way high tech. Uh, Possible future of healthcare? Well, maybe. It is quite interesting. Let's read this from GeekWire. Robot is helping to treat man with coronavirus in special isolation room at hospital north of Seattle. The very first man who was confirmed infected by the Wuhan coronavirus in the United States has been cared for in a specially designed room at Providence Regional Medical Center in Everett, Washington, and a robot is aiding in the process. Pretty cool looking little device. It's also got a stethoscope and some other things on it. I don't see in that picture there where the stethoscope would be, but I know it has one. Let's see here. According to reports in The Guardian, CNN, and the Everett Herald newspaper, the man in his 30s is a Snohomish County resident who had traveled recently to Wuhan, China, where the virus originated. He was transported to the hospital north of Seattle by ambulance and was in a protective gurney called an isopod before being placed in a protective room. Inside the room, the man has been tended to by a robot equipped with a stethoscope, which takes his vitals and allows doctors to communicate with him through a large screen, according to Dr. George Diaz, Chief of Infectious Disease Division at the hospital. Now, I am wondering here what exactly an isopod is. Isopod. So, medical transport. Let's see here. Transport. I'm not talking about an isopod, the animal. That is an isopod. That is the thing from E.T. That's what it is. It's the thing from E.T. Right on. Very cool. If they'd have explained it like that, we would have known. The isolation chamber from E.T. is what he was transported in. Then we would have all known, right? Maybe not. Some people might not even know what E.T. is. Never mind. Scratch that. Showing my age here. The nursing staff in the room move the robot around so we can see the patient in the screen, talk to him. So the nurses go in the room, not the doctors. The doctors are too important. Okay. The use of the robot minimizes exposure of medical staff to the infected man, except for the nurses. Except for the poor nurses. Okay. The two-bed isolated area is reportedly away from other units at the hospital and has a separate air filter, according to the Herald. It was set up about 5 years ago during the Ebola crisis, and this is the first time it's been used in a real-life scenario. Meanwhile, at Fred Hutchinson Cancer Research Center in Seattle, more specialists are lending their expertise in tracking down the evolution of the virus in real time. All right, well, the future of medicine. That is the last story I've got for you today. I am exhausted. I feel like I haven't slept in days. Forgive me for fumbling over my words at times. As I said, I am rode hard and put up wet, as they used to say back in the caveman days. All right. That's what I got for you. I don't know, man. I don't know. Future of healthcare? I could see it. Let me know what you think. I will see you guys tomorrow.